Hello everybody, this is Dr. Thesterman. Today we're going to go over febrile seizures as we recently had an interesting case. So a little bit about febrile seizures. They occur in about 2 to 4% of children less than the age of 5. Generally about 30% will have a recurrent episode. So that's a little bit of background on it. But generally, you divide the febrile seizures into just a typical febrile seizure, then you have complex febrile seizures, then we have something called febrile status epilepticus. So typical febrile seizures occur in the age group of 6 months to 5 years. Usually you find a temp greater than 38 degrees Celsius or 100.4 degrees Fahrenheit, and the child must not have a history of previous non-febrile seizures. So if the child has a history of seizures in the past that are non-febrile related, we don't call it a febrile seizure. Typically, they last less than 15 minutes, and there is no reoccurrence in 24 hours. It usually does not require any medications, and generally there's no prolonged postictal episodes involved. And what does postictal mean? That's that period after a seizure where they appear confused, somnolent, whatever you want to call it, but they're not at their baseline neurologic status. But with febrile seizures, generally this doesn't last very long, and they go back to their normal neurologic status very quickly. Now, complex febrile seizures can be generalized or focal, and what that means, generalized means the entire body shaking or tense, or you can have focal, which is one arm or one leg, but they tend to last greater than 15 minutes, and they can recur in 24 hours. So you may have someone say, yes, he's had 2 or 3 febrile seizures in 24 hours. Now, that's a complex febrile seizure. And then finally, we have febrile status epilepticus, which is just as it sounds. You have a febrile seizure that lasts greater than 30 minutes, or a series of intermittent febrile seizures where they seize, they stop, they seize, they stop, but they do not have a baseline neurologic status that recovers in between those seizures. So they may be very somnolent, they may be out of it, and then they go right back into a seizure. And this can last for longer than 30 minutes or greater. So this is really important to differentiate, obviously, for the hospitals because they have to give different medications. So in the cases of typical febrile seizures, usually they do not require any medications because they resolve on their own. Complex febrile seizures, though lasting longer, we tend to have to give Versed, which is available to us in the field. And then with febrile status epilepticus, hospitals end up having to give other drugs and other anti-epileptics such as drips, such as Keppra or something else. So what do we do from a pre-hospital setting? Well, the most important thing, first of all, is looking at the airway. Make sure they're satting okay. Make sure they're effectively breathing. If you have to, you can bag for them, do blow-by, whatever you need to do, manage that airway. Check a blood sugar. Make sure it's not hypoglycemia that's causing the febrile seizure. Also, what you want to do is check with the family if there's any other history or ingestions possible. And then if you do determine they need medications, we give Versed. If they're less than 3 years old, we give 0.2 mg per kg. If they're between the ages of 3 and 11 years old, we give 5 milligrams. And in 12 to 15 years old, we give 10 milligrams. And we give it all IM because we do not want to wait for an IV. And then you can repeat that in 5 minutes if they continue to seize. So otherwise, all these patients obviously get transported to the hospital. I hope this has been helpful. As always, reach out to me if you have any questions. Thanks for your time.